Getting much better. There's, of course, Dr. G, Denny Ross, Autumn Loans with us, and we're going to talk today about Ultra Skin and Hair. Jody, Denny, you guys have been involved with it. And Autumn, when I ask you about this beautiful new company, what's the 10,000-foot answer on what Ultra Skin and Hair, this beautiful company, is all about?
Ultra Skin and Hair is it's a medical spa that was started by 2 physicians and 1 nurse practitioner. So it's very medically involved. We have a laser that we can do skin rejuvenation and hair restoration. And then we also do injections, including Botox, and very soon we will be offering fillers as well.
I think what differentiates us from other companies is we're all medically trained people. We're doctors and nurse practitioners. We understand that when you perform procedures like this, you want to make sure that somebody who has medical background knows what they're doing with them, because any kind of treatment can have a side effect. And you want to be able to go to somebody you have trust that they understand what the side effects could be and how to manage that.
You know, Denny, and I guess let me jump in here. So you're telling me and this is a newbie question for me, a total newbie. There are some of these clinics that don't have MDs staffing these clinics. Is that correct?
Well, they may have an MD that's in the background, but not very involved. So they predominantly will be doing these procedures as estheticians, which they have training. They've trained to do the procedure itself, but many of them have very little medical background. So they don't have any experience with medical illnesses to deal with that. So it isn't that they don't have some physician involved in some way, but often they're somewhat limited in their involvement.
Well, I think the advantage we have here too is that Autumn has a great medical background, but also she has done various aesthetic procedures for a long time.
Correct.
And your results are good. Your indications are absolutely excellent, in my opinion. What we're doing here for many people is we're replacing surgical treatment, plastic surgery, some way to get some of the wrinkles out of your face. We're replacing that kind of open procedure with this procedure, which is a laser procedure. And you guys can explain that a little bit in terms of how that works.
So Autumn, I'll ask you because I know the answer, but I'm going to ask you to explain it to people. The laser that we use is called the Lutronic Ultra Laser. So this laser, as opposed to some other types of facial treatments, generally has a low downtime. Isn't that correct?
Yes. So our laser is very comparable to those ablative lasers. The ones you've heard about are Halo,
Genesis,
I think the Morpheus. We have very similar, if not better, results with our laser, but we have little to no downtime. We always tell the patient they're going to leave with a mild sunburn-like effect, and that'll last only 3 to 4 hours. You can return to work immediately. We have a lot of clients that come in over the lunch hour and get a laser treatment, but there is little to no downtime.
So does it hurt?
No, it is not painful. Your skin may be dry for the next couple days, but we just say moisturizer is your best friend. Keep it close by. But no, there's no pain. It's not. We give you a fan if you feel like your skin is getting hot, but other than that, there's no.
Well, having experienced it, it is a little bit of a tingling sensation, or a little like a pinprick or something, but it's not a severe pain. It's not like something you can't tolerate.
Right.
Some places do apply a topical anesthetic type cream to help with that. But for the most part, 99% of people don't require that thing. You may not know this, but I'm really 100 years old, and I have this. No, I'm just kidding. But it does really make your skin feel like baby skin, really, after it's completed. So at first you have kind of a sunburn kind of feeling, then your face feels like it's got sandpaper, then that kind of sheds away and your skin is soft and smooth. It's really wonderful outcome with that.
I think the most important thing too is that as we look at alternatives, well, what's the major alternative here? if you're going to have something done with the wrinkles in your face,
Yeah.
heretofore it's been plastic surgery. Plastic surgery is a big procedure. And the other thing that happens with plastic surgery, facial surgery, any kind of surgery that you have, it doesn't leave you with no scarring, and it doesn't leave you with no change in your facial appearance. I mean, a lot of times I'll look at somebody, and a lot of celebrities now have had multiple facial surgeries. And I go, wow, I can tell. I can tell on TV if they've had surgery. And that doesn't happen here. So you have something that's less invasive, it's cheaper, and it's safer. Right? I mean, those are some of the major advantages. And, you go back to work. I mean, if you have plastic surgery, major plastic surgery, I got to tell you, you're kind of hiding out for a few days.
And even if it isn't plastic surgery per se, some of these other types of devices that are used, you'll have a lot of downtime with them. Several days you can't hardly be out in the public because your face will be swollen and red and look pretty bad, I have to tell you. I'm not saying they aren't effective. I think they are, but the downtime is significantly less with these other procedures.
Well, how about Autumn? How is our procedure better than those procedures? The other non-surgical procedures that leave you with some downtime and some discomfort.
Our laser is a thulium laser, which most people are not familiar with. The wavelength allows us to precisely target the upper dermis of the skin and helps get rid of those pigmentations, sun damage, age spots, actinic keratosis, which is precancerous lesions of the skin. And so overall, it gives you, besides getting rid of the pigmentation issues, it gives you a nice fresh glow and also tightening of the skin.
So typically we do 3 to 6 treatments, usually 4 to 6 weeks apart, approximately. That gives really the best results if you do that. It can be of the face only, face and neck, or face, neck, and upper chest.
Yeah.
So it kind of depends on the individual, what they really want to have done.
Well, I think that the lack of complications here is important as well. We just haven't seen people have something go wrong. You're not likely to get an infection.
Yeah.
You're not likely to get hyperpigmentation or lose all the pigmentation in your face, which can happen with some of the other procedures. So I see this as a breakthrough kind of procedure that is not traumatic to the patient, and it's quick. Somebody comes in to get this procedure, Autumn, you can do that in 15, 20 minutes.
20 minutes, I would say. We do a little consultation if it's their first time visit and more in-depth assessment and medical history, but the laser treatment itself is 15 to 20 minutes.
Yeah.
So we can alter the energy level of the laser. Typically people with darker skin, we use a lower energy level, lighter skin, a higher level. So you have to kind of play with this a bit to find out what's best for that patient, because you can vary it to some extent.
But I think that's where, Autumn, you have a big advantage because you've done different kinds of procedures. And you know how to play with this until you get it right. In other words, you're not burning somebody, and you're asking all the time, like, hey, is that hurting you? And you're looking at the skin to see whether it's getting very red or inflamed somehow. And that kind of experience, I think, really comes into play here in getting a good result.
I think it's so important, especially paired with, we're medically trained professionals versus you can train people off the street to do these lasers or give injections. But I've been in aesthetics for 13 years, doing injections and laser treatments. And we've all been to training with this special laser with Lutronic, which is the company that produces this. And we've been visiting and done training with different medical spas throughout the US. So yes, we have a very lengthy history and deep involvement in aesthetics.
I think too, we should really talk about the fact our name says ultra skin and hair. So the device can be used for the hair as well. Now, this is not going to be for someone with baldness. but for thinning hair. And I think we've all seen during COVID, many people, women especially, seem to get hair loss and thinning of their hair. So not baldness per se, but thin hair. And this device will allow us to perform a procedure on the scalp where the laser is crisscrossed across the scalp. And then we apply some proprietary growth factors that help stimulate growth of the hair.
Yeah. And what about this, Autumn? Other things other than wrinkles, freckles, different pigmentation areas that maybe people don't like, because these kinds of things often happen just spontaneously. Anything else? How about
Pigmentation issues with aging, sun exposure, which now is a great time to come in after we've been out in the sun all summer long. And then it also helps tighten the skin. It helps with fine lines and wrinkles. It gives the skin, I've heard a lot of clients say that they just have a fresh new glow to their skin after 1 or 2 treatments.
Yeah. And, we talked about alternatives. There are alternative types of lasers, different kinds of heat treatments, various things non-surgically, as we pointed out. But still, to get the kind of results that we're getting, you almost have to look at a surgical procedure.
Or those very invasive lasers that you leave, in dressings and oozing off your face and, inflammation for days afterwards, that you're homebound.
I can speak personally on this. My daughter had this done, a procedure called a halo procedure. She has a history of a lot of allergies in general. Her face swelled up so much, she had to go into the emergency room and get steroids because of the massive swelling from the procedure itself.
Yeah, that's what happens. I mean, the thing about this procedure that I think is beautiful is that it is so non-invasive. You just don't see people coming back with complications.
But with the same results as those more invasive ablative lasers.
Yeah.
And very effective as well.
Yeah. Our pricing is so competitive. We are somewhat of a startup company. I just tell all our clients, like, now is the time to take advantage of our competitive pricing, because there's no other companies with this laser that offer the pricing we do.
Yeah. And then, we are using this not as a solitary treatment. It's not like once and you're done. So most people are getting 4 or 5 treatments. How often do you recommend that somebody come in and get a repeat?
I always recommend, to get the best results, 3 to 6 treatments. And we usually schedule these 4 to 6 weeks between each other.
Yeah. Okay. What about those precautions to take in that period while you're waiting for your next treatment?
The main thing is just stay out of the sun for the next 1 to 2 weeks.
You have to realize that sort of the outer surface of your skin has been removed. So you're going to be much more sensitive to the sun. So more sensitive to get really a sunburn. So many times people avoid doing this somewhat in the summertime, but do it more during the fall, winter months because of that. You can still do it in the summer months. You just have to be cautious and wear plenty of sunscreen and wear a hat outside. So.
And I think, Autumn,
in the sun, you can go out and play tennis. I just always recommend SPF of at least 30, which you should be doing anyways, and then cover up with a hat or visor if you've recently had a laser treatment.
Yeah. And you're telling patients, hey, don't do anything in the sun for 7 days or 10 days or something like that. Just stay out of the sun.
1 to 2 weeks if you can.
Yeah. And then some other things that have come about where recommendations have been made, like don't drink alcohol. I don't know how long that is a recommendation.
It does not affect the results of the laser. You may get a little more flushing of the skin, which a lot of people do anyways with drinking of alcohol or exercise, but it's not contraindicated. You can do it. It's not going to change the results of the laser.
Okay,
really, that's the best thing about this laser. It is so minimal side effects, minimal downtime, and really no adverse effect at all.
And you can have a glass of wine. How about cigarette smoking?
Well,
I wouldn't encourage anyone to smoke cigarettes.
You shouldn't have a smoke, but
I was going to say,
from the same people, sir.
Yeah, the company is recommending no smoking period, but no smoking for 2
We would
weeks.
also
We would tell you that too.
recommend no smoking.
Yeah, right.
But we would tell everybody, hey, here's your chance. Now you can stop smoking. You've got every reason to. You don't want to cause any damage to the procedure that you just had. No
Right.
damage to your face. And I think this procedure has so much possibilities. What have you seen with treatment of hair loss?
So
Thinning
the
hair.
hair, I would say a little bit of a mixed result to some extent. We've had some patients who have had this procedure done and say they think it really has helped, and others have said, I'm not so sure. I think we've come to the conclusion it has to be kind of a combination of things. The laser with these growth factors can be very effective in some people, but often if you combine it with other things, either like topical minoxidil or perhaps Propecia, but what we're going to be offering soon is this. It's a laser cap. So this laser cap, if you look in the literature, it's been shown to be effective in people in improving their hair growth, hair thickness, hair size. Now, it's important when you look at these possible devices to be sure to pick one that's a laser cap, not just red light therapy. Our laser cap here has 302 laser diodes. You wear it for 7 minutes a day and really no side effects. The only side effect, it gets warm. Your skin might get a little bit dry or itchy, but other than that, really no side effects. If you combine the laser cap with our laser treatment of the scalp and the growth factors, I think we're going to get the best results from that. We sell this laser cap as well as the other growth factors and, of course, the treatment itself.
So, Autumn, somebody could come to you and say, hey, I want that cap. And you could,
or they
you
could
could
check it
help
out. It will soon
get it.
be offered on our website. But
Yeah.
I just want to explain the laser that we offer is not only good for skin rejuvenation, we use it for hair restoration, which thinning of the hair, like Dr. Ross had mentioned. The laser creates microchannels down to the hair follicle during the procedure. And it also is pain-free, no downtime with that. And then we have Carifactor serum that we massage into the scalp, and we encourage the clients to buy a take-home bottle so they can use it every day, along with the red light and laser cap.
And so it's Ultra Skin and Hair, Autumn, is what we're talking about. ultraskinandhair.com. That's the live site right now, right?
That is correct.
Okay. And
That's
where
fine.
about are the procedures being taken place? Where are you guys seeing patients? Have we got to that? And where's that located?
We are in Wichita, Kansas.
Okay.
Currently we're at Rock and Central Avenue in Farha Aesthetics. It's a medical spa that she does not offer this same laser.
Okay.
But we are the ones doing the laser procedures. And just call us or reach out on the website to us to schedule a consultation, or you can contact me by phone at 316-339-0070.
Okay. We'll pull shot. Okay.
Yeah. What about this? How many women are candidates for the hair procedure?
I will say, and Dr. Ross had mentioned, you're not a great candidate if you do have balding spots, which a lot of men notice the balding spots. They don't notice the thinning of the hair as much, but women have loved this procedure. And I think it's the ones that we ask initially right after their third or sixth treatment, have you noticed, more hair growth? And they'll say, well, I haven't really, but you have to realize that the hair growth cycle will be ongoing for the next 12 weeks to see the final results of this. So we've had women, if we follow up 12 weeks after, they love the results.
Yeah. And there are more women, purportedly, 50% of the women over the age of 60 have significant hair loss. Mm-hmm. And they, you cover it up by combing over it. And what I noticed is just a lot of lines where that happens. And I go, there's been significant hair loss here, but not many women are getting They're not getting robotic treatment. They're not getting surgery. Usually they can, and those are procedures that may help them. But this is a procedure they can have and go home, and they don't even have to tell their husband they had that procedure. I mean, it's just a non-invasive procedure that leaves no scars. And Denny,
some people have used PRP for this type of thing, but you have to realize that PRP, which is plasma-rich, platelet-rich plasma, it's more invasive. They have to get injections in their scalp, which is uncomfortable. And there have been some data to suggest that what we do has a more favorable outcome compared to PRP.
And I'd like to add that the Carifactor serum we use, it has 5 human growth hormones that are directly made, I guess, or produced that replicate hair regrowth.
Yeah.
And then 2 skin proteins that really target thinning of the hair deficiency and scalp health deficiencies. So it's all directly targeted towards hair regrowth.
With PRP, they draw the patient's blood out, spin it down, use their plasma. In some cases, that plasma has factors that actually inhibit hair growth. So it's an unpredictable thing with the PRP. It can be effective, but it may not be effective at all. In fact, it may have a negative result. Here, we're using laboratory-produced growth factors that have a consistent result.
All right. So how many times would you recommend, Autumn, that somebody come in for the hair treatment? Is that 3 times, twice? What do you usually how often do you have to administer it to get a good result?
To get the optimal results, again, I would say 3 to 6 treatments. About 4 to 5 treatments is what the majority of the clients do, because by then they're seeing great results and are happy with the laser treatment.
Be about the same for the facial treatment.
Very similar. The facial treatment,
Probably not quite as good.
yeah, the facial treatment really depends on the level of melasma or age spots or the pigmentation issues that you're dealing with.
Yeah. So when somebody comes to you, they get 1 treatment, you tell them you're probably going to have to come back.
Yes, I would say after 1 treatment, you may see some results, but definitely after the 2nd and 3rd treatment, you see significant results in your skin. And so again, 3 to 6 treatments is a recommended.
Yeah. Now, if you get plastic surgery on your face, it's a very expensive procedure. If you get 4 or 5 treatments with our laser, how expensive is that?
Depends on how much they have done. Is it just the face only, face, neck, and chest? And then we'll package, if they want to buy right up front 3 treatments or 4 treatments, we'll package a deal for them to give them a discount. But in general, it's about $300 for the face, $350 for the neck, and is that right? $300, $350, and $400.
Yeah.
Sorry.
I would say just everybody's different. Every client is different. The extent of their melasma or thinning of the hair. We do have package deals. So I would like to do a consultation and we can discuss even over the phone what best fits that client and pricing. Again, pricing is very competitive. And after I give, them the price of what I would recommend, they can shop around, but I doubt they will find anything better.
Less expensive.
Yeah.
One thing that I have found just in perusing the literature is that our pricing is very low compared to the world around us.
Oh, very much.
It is.
I think that what we've tried to do here is introduce this technology to the people of Kansas, to the people around us. And doing that, we're doing it at the best possible rate for them. Now maybe over time, I don't know how that would change, but right now, you're not spending an arm and a leg. This isn't a tenth of what it would cost to have one of the other procedures or plastic surgery.
Right.
And the downtime is so minimal. And how about hair replacement, Denny? We do hair replacement with the robot. We do that.
So we have these two entities that really focus a little bit differently, even though the ultra laser does work with thinning of the hair. But for particularly men, probably more than women, but women also, who have very severe hair loss, we're talking about baldness, then hair transplants is the next option. And that's hair by robotics. So in that case, we actually do hair removal from the back and implant it in the areas where it's bald. So this is a bigger procedure to go undergo, more expensive procedure, but a very effective one. So that requires a consultation to see exactly what that patient needs, to review with them what we think we can do for them. We create the sites so we know which direction the hair is going to go, where their part will be. They are participating in the decision making of how they want their hair to look.
Yeah.
So we have two doctors that do this, Dr. Amy Sproul here in Wichita, Dr. Craig Barberi in Kansas City, using the ARTIST robot. In some cases, we use it manually. It just depends on the patient's situation, and don't use the robot. One of the advantages of the robot is that it's gentler on the hair removal when you remove the follicle. So they believe that it has a greater chance of survival long term, as opposed to manually removing the hair.
Yeah.
Hair is not going to regrow in the spot where you took it out. So you want to try and get the best outcome result if you can by minimizing any loss of hair when you do this. Typically, we'll implant somewhere between 1,000 to 2,500 hair follicles to do a hair restoration by transplant.
Yeah. And the recent data is telling us that those transplanted hairs, those follicles, have about an 80 to 85% chance of survival.
Right.
Whereas if you are balding, you're losing your hair.
Yeah.
That is a progressive process if you do nothing. I mean, it just goes on and on.
Right.
People don't just lose a little spot and then, nothing happens. Over time, if you do nothing, you wind up bald. And so the robot has really been a breakthrough, because once you put a follicle in with the robot, it stays there. But, Denny, we've seen many people who then later come back and they've got a round area that's now losing, their natural hair keeps falling out.
Mhm.
So they need more hair with the robot.
And as you're aware, the original hair transplant procedure was a strip procedure. Strip meaning they take out a strip of your scalp,
Yeah.
sew it shut, but you have now a long scar, and it's the outcome is not nearly as pleasing, because you have a scalp scar that's from removing that strip of hair.
Yeah. And the long-term results are not great. And
No.
there also is a chance of infection
Yes.
in that area. That does not happen very often with the robot. I mean, we just aren't seeing infection at all. It's certainly possible, but very, very unlikely. And people don't have a major operation. So in a couple of days, they can go back to work, they can do whatever they want to do, and they don't have any visible evidence that they had
Right.
that robot procedure
Right.
done. I mean, I think the robot is a wonderful procedure. How about combining the robot with the cap, or combining the robotic treatment with with the Ultra Skin and Hair product?
Well, they have combined the cap with the transplants, and that's been effective. Also, using some of the topical treatments that are for thin hair helps as well. So you can combine these treatments and many times get an even better outcome.
Yeah. Well, the big news, of course, is ultraskinandhair.com. Kind of a celebratory little broadcast. We thought we'd jump on this thing. Autumn, a couple of more things about contact numbers. Can you share with us? And maybe some final questions as we round robin before we go. But beautiful website. You guys can check that out. Again, it is ultraskinandhair.com with three familiar faces on. See?
Or you can reach out for a free consultation or schedule an appointment at 316-339-0070.
Perfect.
Hey,
And we also do injectables, Botox, and we'll be soon adding fillers. So our menu will only be growing. from here on.
Love it.
And what about this, Denny? If somebody has their hair transplant with the robot, that's going to cost maybe maybe $10,000.
Well, anything from about $7,000 to $12,000, but I think it just depends on how many follicles they need, how involved the whole procedure is. It is a long procedure. I mean, you'll spend all day doing this. The hair is harvested in the morning, implanted in the afternoon.
Wow.
It's a long procedure, not particularly painful, but it is involved to do it. It involves having techs, a doctor, a robot. So it's a much more involved thing to do. I'm not discouraging people from having it. It's just that they have to realize that it is a big procedure to do. And usually one is all you do. Sometimes if they require a lot of hair follicles, it's divided up into 2 procedures.
Yeah.
And that is more for balding spots.
More for balding spots, correct.
Thinning of the hair.
Yeah.
We can use a laser.
Right.
And if you were to add the cap, that might be another $1,000.
Yeah, the cap, the list price for this cap I showed you was $12.99, but we will provide some discounts for that if they are doing some other procedures with us.
Yeah.
It's if you compare caps on the market, this one will have the laser diodes compared to any of the others. So I think it's a very excellent cap to use.
And they're recommending 7 minutes a day.
This one, it runs for 7 minutes. It automatically times it for you. You just put on the cap in the evening, turn it on. It'll turn itself off after 7 minutes.
And I think I've heard someone say they carry it in the car and wear it in the
Yeah,
car.
they do. Yeah.
Well, it's not a bad looking cap.
Not bad.
Like, I think the people that I've spoken with have felt good about the results they've had with the cap.
Yeah.
But think about this. If you did a hair transplant, okay, say that's $7,000 or $8,000, you're only adding maybe another $1,000 for the cap. And then occasionally you could have the laser treatment, which might make the hair sustain, the transplant sustain its life longer, give you a better result. But still, it's better than having it done again.
Correct.
Or, having a different procedure. So I think technology is really evolving here. And also people aren't so afraid to get a hair transplant, or they're not so afraid to get something done on their face. To have a facelift with surgery, that's pretty intimidating for a lot of people. Or if you go to a woman and say, "Hey, look, you know what? We're gonna do a robot on your hair," and that's gonna require that we cut some hair and shave some hair off your head for a while, and then let your hair grow back. That's like, wow, am I that bad? So I think these newer technologies are evolving quickly, and I think they're exciting, and I think they're helpful for people, and they're not outrageously priced compared to what's available.
Yeah.
Hey, thanks you guys.
Ultraskinandhair.com. One more time, Autumn, on this. Ultraskinandhair.com. Free consults if they reach out to you, right? Or do you charge for those?
No, free consults.
Okay.
Through therapy for your skin and hair.
Hey, thanks you.